Hi folks, Jake Lacey here with US Medicare Group. Wanted to talk to you today about what Medicare Advantage is. I'm sure you've gotten a lot of pieces of mail lately. People want different insurance companies wanting you to sign up for this $0 premium plan or $25 a month plan, and it sounds really great. But what I really want to talk to you today about is what you could be exposed to if you do sign up for one of those $0 plans. Specifically talking about how your doctor's network is actually limited, and on top of that, what it could actually cost you for signing up for a free plan. So what exactly is Medicare Advantage? Essentially what Medicare Advantage is the federal government giving the responsibility of providing you medical coverage to an insurance company. Voiding your red, white, and blue card, making you no longer a part of original Medicare. What that means to you, essentially, is that your doctor's access is now limited because the insurance company got a set dollar amount to provide you coverage for the year. And one of the ways they actually cut cost is to limit the actual doctor network and only putting doctors in the network that accept a low monthly rate per patient. One of the main problems we do have with it is when it comes to you actually getting care, typically what happens is they try to do the lowest cost procedures first and hope that fixes the problem. Now if you have cancer or something like that, it might take you a couple months before you actually find out you're diagnosed with cancer. And for most people out there who've dealt with someone or known someone who's had cancer, well, you and I both know that when it comes to early detection, it's one of the key factors in getting treated and actually recovering from cancer. That's why most of the time, in most cases, when we talk to clients, we don't recommend any kind of Medicare Advantage for our people here at US Medicare Group because it just doesn't cover our clients as well as if they were to stay on original Medicare and get a supplement. And then we'll actually go into what it actually costs you. The main problem there is that you can't actually have a fixed rate for what your health care is going to cost you per month. And most seniors out there are on a fixed budget. You get your Social Security, maybe you get some retirement benefits through an IRA or a 401k or a pension, and that's the amount of money you have to spend for the month. If you look at the summary of benefits on these Medicare Advantage plans, what you'll find is that they have out-of-pockets of sometimes $6,700. Which, initially someone might think, hey, I can swing that. Well, that's not always the case because if you go to the doctor in, say, October and November, say you have pneumonia and you go to the doctor in October or November, and you end up staying in the hospital 3-4 weeks and you end up paying $6,700, well, you're fine with that initially and say, okay, I'm fine, I paid my deductible, I can get whatever care I need. You're all fine through Christmas, New Year's Day, and then say 1 week after the first of the year, you have to go back to the hospital because the pneumonia came back or you fell and broke your hip or something happened, you find out you get cancer. Well, what happens is now that it's the new year, since it's a new calendar year, it's past January 1st, now you got to come up with another $6,700 out of pocket. So in the span of 4 or 5 months, what happens is you're coming out of pocket $12,000, $13,000, and that's just not feasible for a lot of senior citizens on a fixed budget. So like we said before, the best route is to go with original Medicare, so you keep your doctor network and access very large. You can go to any state, any hospital, any doctor that accepts Medicare and just get a supplement to actually offset those costs. That way you know every month going in what you're going to pay for your health care costs. It's a fixed cost and you won't end up getting a $2,000-$3,000 bill. I suggest you take some notes, finish watching all the videos on here that teach you about supplements and the other types of Medicare out there, how to get a drug plan, and when we have our appointment coming up here, we'll actually go over whatever questions you have about it and get you all taken care of. If you haven't scheduled an appointment with us yet, feel free to shoot us an email or give us a call, and we'll get something set up so you can get all your questions answered and be taken care of. That way you know going forward from now on that you have a set cost in your medical expenses and you actually have better coverage than you ever had before turning 65.